Hi guys, Bridget Surratt, Ganja for Autoimmune Arthritis and Canna Patient Resource Connection here. And I have a major problem with the pro-cannabis community. I'm parked, so I'm going to take my seatbelt off. But I do wear your seatbelt. I do wear my seatbelt. Anyway, I have a major pet peeve with the extreme pro-cannabis community. And that pet peeve revolves around the inability of people to say anything negative or anything that could be perceived as negative about cannabis at all. Just to give you an example, and the reason I'm doing this video, we recently had a discussion about pregnancy and cannabis and the risks posed by CPS, not the risks posed to the baby or the health or anything like that, but risks posed by the legal status of cannabis. And there are risks if you are even in a legal state. There are risks if you are pregnant and you decide to use the safer choice over, say, something like Zofran or any of the biologics, say you have a chronic illness. There are parents who are choosing to use cannabis over those other drugs, which are much less safe. Okay, fair enough. But the discussion was about CPS risks. And I had mentioned that if they test you, there is a chance that you could lose your child. There is a chance you could be put on probation and those types of things. And I was eaten alive. They did not want this poor mother to know that there could be a risk. They said, oh, you'll be fine. I was fine, so you'll be fine, even though I'm in a different state with different laws, different doctors. Of course, nobody could guarantee that person would be okay. So my question to you is, why is it not okay to say something like, you can choose to use cannabis during pregnancy, but there is a risk from CPS. They are testing and you don't have to consent to the test. Theoretically, you should, but they're doing it without consent if they feel like they have probable cause, and it is a risk. Another example, medication interactions. Cannabis interacts with some medications. THC is an opiate receptor agonist. We like that reaction, but it is an interaction. You can have, opiate toxicity because the cannabis actually increases the availability. It's an agonist for the opiate receptors. You like that. That's how we're able to get off opiates and use cannabis for pain control. But when you mention that, a lot of people freak out and go, oh my God, it doesn't do anything. And no, oh my God, no, it's a cure-all. It doesn't do anything. And that's another issue, is the cure-all thing. Okay, cannabis is a cure-all. No, it's not a cure-all. Why are we saying that when it's not? It's a cure-all if you have a curable disease, such as particular types of cancer, if you have broken bones, or if you're treating for those things. But generally speaking, if you have a chronic illness, given autoimmune disease as an example, once you remove the cannabis, a lot of times those patients' symptoms come back. 9 times out of 10 they do. So it's not cured, even though it helps regulate that into remission. It's not cured. But a lot of people have a hard time saying those things. And my advice to everybody is be realistic. It is okay to be realistic. It actually gives us more credibility when we are realistic, rather than spewing all of this misinformation, this bad propaganda that's coming out because so many people are desperate to have it legal. I get it. A lot of people are desperate to have it legal. A lot of people are desperate for this treatment. But that doesn't mean we lie about it. That doesn't mean that we give false information and false senses of security to people. If somebody is having a baby and they choose to use cannabis, they need to do it fully aware that there is a real risk involved. If you don't, and you lie to that mom and say, I was fine, you'll be fine, there's no risk involved, and something happens, you're at fault for that. You are liable for that. I don't know many people doling out that advice who are paying for those folks' lawyers. So please, as you guys are giving advice and out there fighting for the cause, please remember that it is okay. It is absolutely okay to say some not so splendid things about cannabis. It really is. You know, I'm sorry, but it is. And realistically speaking, a lot of the folks who are spewing this bad information are part of the problem. They're part of why we're having to fight so hard to get it, because we have no credibility. We have no legitimacy because of that type of propaganda. And that needs to stop. So, sorry you had to hear about my pet peeve, but be honest when you're talking about cannabis. Yes, it interacts with other drugs. If you're taking selective serotonin reuptake inhibitors or anything that works on the acetylcholine pathway, cannabis is going to interact with it because that's what it does. Those are the pathways it works on. That's what it does. That's a good thing in a lot of cases. It really is. If it can take the place of SSRIs, isn't that what we want? Okay, that's good. So admit that it interacts with them. Just saying. Interacts with opiates. Admit it. It's a great thing. We're all trying to get off opiates because we hurt. You know, I'm off opiates, which is thankfully awesome. But seriously, it interacts with opiates. I was able to use less opiate and wean because I had access to cannabis. Biologics, same thing. They act same way. So they're kind of complementary and they could even interact with each other. We don't know. That's great. But it's okay to say that. Is there a legal risk for using cannabis when you're pregnant? Yes, even in a legal state. And it's okay to say that. All right, guys. Speak the truth. Get out there. Fight legitimately for the cause. Cannabis can stand on its own merits. It really can. It doesn't need us to lie about it. All right, guys. Take care.